You're on?
Yes.
Oh, this morning, sorry for the late start. This morning we are supposed to be discussing the gluteal region. Okay? Now, we know that some of the boundaries of the gluteal region actually starts from the iliac crest. Okay? And of course, you can easily recognize some surface markings, such as the posterior, superior iliac spine, and of course, really in human subjects, this usually corresponds to that dimple that you usually see in the lower back. Okay? When you go to the beach and see the young ladies in the bikini, those two little dimples, or if you're wearing a hipster pants. Okay? Now, we all know the iliac crest, and we all know that the iliac crest really runs around, okay? Hip bone, and of course, we know that prominent anterior superior iliac spine. In other words, this is the os innominate bone. Okay? So we know well recognized portions. This is the ischial tuberosity. We know that this is the hip, right? The acetabular fossa. And then, of course, we know the pubic symphysis, as you can see here. And we know the superior pubic rami, inferior pubic rami. Now, we know that this area is really the gluteal area. The hip bone, which really would be sitting here. What you should appreciate about hip bone is basically this is the acetabulum. Okay, and then of course we have the greater, right? Greater trochanter and the lesser trochanter. Okay, and of course this is really the neck, okay, of the femur itself. Now, remember that the muscles of the gluteal region is actually sitting in this area with respect to the bone, okay? Because this is really the posterior aspect of the femur. So we're sitting over here. So if we look, we will also recognize that on the bone, you really have this, the superior sciatic notch, and of course the inferior sciatic notch. Okay? So with these notches, of course you can recognize this as your ischial spine. Now we know that when you go to your atlas and you look at the specimen, there are some very powerful ligaments, okay, that are extending here. In other words, the sacrotuberous ligament, right, the iliotuberous, and the iliolumbar ligaments, all of these are important. The sacrospinous ligament is very important insofar that it forms the greater sciatic foramina and the lesser sciatic foramina. And this is very important. So you should really appreciate and go to your atlas to basically review the skeleton, the actual bone, the os innominate bone, which is basically the first proximal bone of the distal appendicular skeleton, and of course the sacrum is basically the terminal part of the axial skeleton. The sacroiliac joint is basically inside there, and of course remember I told you that most of these joints, in terms of where the axial skeleton meets the appendicular skeleton, it's not only synovial joints that are important here, but the synovial joints are pretty weak. It is more the syndesmotic joints due to the ligamentous attachment. Okay? Now, when I went over the axilla, I pointed out the coracoid process. And you will remember from the coracoid process, you had a very important structure, which is basically the pectoralis minor, which was basically a reference muscle. Okay? I want you to basically equate the coracoid process and the ischial spine as basically almost equivalent in terms of upper limb, lower limb. And of course, really, there is that ligament, and then coming out of here, there's an important muscle, right? Called the piriformis muscle, which actually occupies most of this greater sciatic foramen, okay, that you should appreciate. All right, so much for that. The gluteal area, as you can see, this is really a dissected specimen. Of course, it has lost a lot of its fat, but of course, we can recognize that superiorly, you really have in this region, right, the iliac crest area, and then of course, if this is cut in the midline, you would find that this is overlying the sacrum, and then this is basically descending down into the natal cleft, which is basically coming all the way down into the perineal area. So the anal triangle area and then the urogenital triangle area. Inferiorly, you find that there is really a fold, the inferior gluteal fold. Okay? And this inferior gluteal fold is said to represent the actual flexural crease associated with the hip joint itself. Okay? Now, a lot of misnomers that people arrive at is really that people believe that the gluteal area and the big muscle that is associated in this region, the gluteus maximus, the inferior gluteal fold and the lower extent of the gluteus maximus is essentially one and the same, and that is not true. Okay? In other words, the gluteus maximus is really lying somewhat higher in this particular area, and its fibers are actually descending, right, almost at that sort of 45-degree angle from the sacral area coming, all right, moving posteriorly and laterally. Okay, now, if we dissect this specimen off, okay, and of course, having removed the specimen, having removed the skin flap, we have actually dissected off a lot of the gluteal fat. Okay, so you must remember that really what you see, right, on the backside here, okay, if I should use that term, not in a derogatory way, the back side, okay? All of that round that you're seeing there, it's really not muscle. It is more a lot of fat, okay? And of course, in recent times, a lot of young ladies is taking on this practice of enhancement of the gluteal area, okay? Everybody wants to see a big booty. It is really the fat, okay, that is constituting all of that round, okay? Now, once you dissect the gluteal area, remove the skin and the subcutaneous tissue, you're actually exposing and you're coming on the very first muscle, okay? The very first muscle. And the first muscle that you're actually seeing is the gluteus maximus. If I should come back to our pelvic, right, here, you find that most of the attachment of, okay, most of the attachment of the gluteus maximus is actually taking place all along this area, the area of the posterior superior iliac spine, running all the way down towards, okay, the upper limit of the greater sciatic notch. And then, of course, it's also taking purchase along the lateral aspect, okay, lateral aspect of the sacrum, including some of the ligamentous attachment, such as the iliosacral, sacroiliac, posterior sacroiliac ligament, and of course the sacrum tuberous ligament. It's taking purchase of the ligament also. Now, as you can see from this particular specimen, the fibers are actually running in a inferior-lateral direction, okay, as it really moves laterally, okay? Now, of these particular fibers, they are usually, the muscles can actually be divided into an upper half and a lower half. And then when it comes to the lower half, you really have what we call the superficial segment of the gluteus maximus. And you have the deep section of the gluteus maximus. The deep section of the gluteus maximus, which is basically the lower half, but the deep section, which we could say a quarter of that particular muscle, is actually being inserted into the gluteal tubercle here, the ridge that is really coming all along here. Okay, whereas the more superficial muscles are actually passing over, okay, the back of the upper femur. Okay. Now, these fibers, the upper half and the superficial fibers of the lower half, they are going to be inserted into the iliotibial tract. Okay, the iliotibial tract, which is a very important structure, which really takes its purchase, okay, from the iliac crest area, and of course inserted in that superiorly is a muscle which we call tensor fascia lata, and of course the iliotibial tract is usually a very important extensor of the knee joint, right? Very important extensor of the knee joint. So these particular muscle, okay, will therefore be what we call more an extensor of the hip joint, okay? Now, the muscle itself is not very active, okay, especially when you're talking about quiet walking, for instance, because the shorter muscles around the hip joint is very important. However, this muscle is a very important anti-gravity muscle, especially when you are, for instance, moving to sit down from the standing position, or if you're basically rising from the sitting position. This muscle is actually brought into play. Now, with more strenuous actions involving the lower extremity, such as in running, for instance, these muscles are extremely important in terms of really extending the hip joint. And of course, these muscles are actually well developed in athletes. Okay? Now, once we take off this muscle and elevate this muscle, what we are actually exposing is really a set of muscles below that particular area. Okay? Now, I don't think that this section is extremely clean, but let us go back to the ossinominate bone, and you will notice that there is a green line here, there is a red line here, and there is really another green line here. These lines are actually drawn on prominent ridges on the back of the ossinominate, the iliac section of the ossinominate bone. And these elevations is representing where the fascia overlying the smaller gluteal muscles are actually taking purchase on the bone. This is called the inferior gluteal line. This is called the middle gluteal line, and this is called the posterior gluteal line. In between these areas is areas demarcated for the actual insertion of the three small muscles around the hip joint. Okay, there is the gluteus medius, the gluteus minimus, and then in this particular area, we have the insertion of the tensor fascia lata. Okay, in this particular area. This specimen that we're looking at here, this is really showing the gluteus maximus, which has basically been excised. And what you can appreciate here is really the small muscles here. Now, this muscle that you're seeing here is actually the gluteus medius, that is actually sitting here. Gluteus medius is sitting here. And then in this particular area, just lateral to it, is the gluteus minimus, which is basically sitting side by side. Okay? Now, these two muscles are actually arising from the area, the medius and the minimus in this particular area. They usually have their insertion pretty high in these particular areas in which they are somewhat free from the bone. And this basically allows the muscles to contract and move. Okay? Usually there are sometimes bursars usually sitting below this particular area as it really moves towards the greater trochanter of the femur. All right? Now, where these muscles are inserting, they are inserting in the superior. The medius is inserted in the superior area of the greater trochanter here. And then the medius is actually inserting somewhat on the anterior and slightly medial aspect of the greater trochanter. You can see as a result of basically being inserted here with the acetabulum here, contraction of these particular muscles would therefore be responsible for abduction of the hip joint. Abduction of the hip joint. Okay? They are actually abductors of the hip joint. Okay? The gluteus maximus, by virtue of its insertion here, as much as it is an extensor by virtue of its insertion in the iliotibial tract, its major action is really a lateral rotator of the hip also. Okay? So it basically, most of these muscles around the hip joint will have multiple actions. Okay? Unlike in the upper limb. All right? We won't be able to demonstrate tensor fascia lata, which is basically arising more lateral here, but that is basically inserting the iliotibial tract. Okay. Now, what you should appreciate about these muscles, okay, is that they are actually their blood supply and their nerve supply. Okay. Now, the small muscles, okay, which is basically sitting beneath the gluteus maximus, is actually receiving their innervation by the superior gluteal nerve, okay? And the superior gluteal nerve, okay, is actually a nerve that is basically exiting the pelvis, okay, right? Coming from the lumbosacral plexus, is actually inserting, is coming out of the greater sciatic foramina. Now, we know that the greater sciatic foramina has a very important muscle, which is really exiting, which is really arising from the second, third, and fourth part of fourth sacral segments, and is actually running out, okay, of the notch, and is actually coming to actually insert into the medial aspect, and you can see this little notch here. This is basically where that particular muscle is actually inserting, okay? Now it is inserting there along with another muscle, which is called the obturator internus muscle, okay? The obturator internus muscle actually is, we all know about the obturator externus, okay? We know that the obturator externus is actually sitting over this particular obturator foramen and obturator membrane. And this is a muscle that is really arising here and is running towards, okay? Towards, okay? This region also, okay? In other words, you can see by this pointer, this is usually the direction of the obturator externus. But the obturator internus is actually running, okay? Running out of the lesser sciatic foramina, okay? Remember, we talk about the sacrotuberous ligament, okay? And we talk about the sacrospinous ligament. So that little area, in this area, you can actually see it. You can see the lesser sciatic foramina right here. This is the greater sciatic foramina. This is the sacrospinous ligament, which is basically running in this particular area. So that's a lesser sciatic foramina. The obturator internus is actually having its tendon exiting in this particular area to get to that particular fossa that is sitting on the medial aspect of the greater trochanter. Okay. So the muscle that is running out, right, is actually occupying this greater sciatic foramina. There is a small space above the muscle and a small space below the muscle, but superior to the sacrospinous ligament. The vessels that are coming out in front, okay, of the piriformis is basically the greater sciatic, right? The greater sciatic nerve, the greater sciatic artery, and of course there's usually a leash of veins. In other words, we're talking about the neurovascular bundle. And remember, when we talk about the neurovascular bundle, remember it's always four structures we're talking about. We're talking about the nerve, we're talking about the accompanying artery, we're talking about the accompanying veins, plural, and then of course we're talking about lymphatics. Okay? So the nerve that is really the supragluteal nerve is basically supplying all of the small gluteal muscles, gluteus medius, gluteus minimus, and of course tensor fascia lata. Now, what is the root values of the superior gluteal nerve? The superior gluteal nerve, the root values are L4, L5, and S1. L4, L5, S1. And it is important that you should remember superior gluteal nerve and its root values, because it's very important in terms of how we can assign the actual root values that are supplying all of the individual muscles that we are finding in the gluteal area. Okay? Inferior to the piriformis muscle is really a set of neurovascular bundles. Okay? Whereas there was one prominent neurovascular bundle above the piriformis muscle, there is bundles, neurovascular bundles, and you really have at least 3. Okay? Now, exiting the inferior aspect there from medial, okay, to lateral, okay, what you find is really that the most medial set of the most medial neurovascular bundle, which will be exiting in that particular area, will be your pudendal nerve. Okay? Your pudendal nerve. Okay? And if you remember what your pudendal nerve is actually doing is, as it's exiting, it's actually moving to really wind around, sink just lateral to the ischiorectal fossa, okay? And it's going to want to enter into Alcock's canal. Alcock's canal is really a canal, a fascial canal, right, between the bone and the fascia that really accept the neurovascular bundle, the pudendal neurovascular bundle, and actually it travels there because it's going to run all the way up. It's going to be supplying the pelvic diaphragm, okay? It's going to be supplying the perianal musculature, and of course it's going to terminate into the urogenital triangle area, and of course remember its terminal branch is actually in the phallic structure of the male and the equivalent in the female, okay, as the dorsal nerve of the penis and the dorsal nerve of the gland clitoris, okay. Now the root values of the pudendal nerve, okay, you should try and remember it is usually S2, S3, S4, okay, S2, S3, S4. You will recall that the root values of the obturator nerve and the root values of the femoral nerve is L2, L3, L4. So that makes it extremely easy, okay, to remember that. Okay, now the next, just a little bit lateral to the pudendal neurovascular bundle, is now the neurovascular bundle that is basically going to supply the gluteus maximus, which is really sitting, is really overlying here, okay? So if we can look and see if we can find the I think it's easier on this particular specimen. Okay, the piriformis muscle is basically this muscle here that you see here. Okay, all right. This is the little triangular muscle, and of course, this is really sacrum, and this is the lateral aspect of the sacrum. So you can see this muscle here. This is the piriformis. So this is the greater sciatic notch here. If you, yes, these are the superior gluteal artery, okay, and the superior gluteal neurovascular bundle. And it is really coming out above the superior border of the, right, the piriformis muscle, okay? So remember, this is the neurovascular bundle. Below the piriformis muscle, as I said before, the neurovascular bundles, medially you really have the pudendal neurovascular bundle. Then the next neurovascular bundle that is escaping, just lateral to that, is a neurovascular bundle which is important in supplying this overlapping muscle. Okay? So on this particular, well, on this particular area, you are actually coming in this area on the deep surface of the gluteus maximus. Okay? So the inferior gluteal nerve, the inferior gluteal artery, the inferior gluteal veins, and leisure veins, and then of course lymphatics, okay, are coming out here. Now, what is the root value of the inferior gluteal nerve? The root value of the inferior gluteal nerve, you step down one, you take off the very first number of the inferior of the superior gluteal nerve root values, and then you add one on the lower side. So instead of L45S1 for the superior gluteal nerve, okay, then the inferior gluteal nerve would be L5S1S2. Okay? Inferior gluteal nerve L5S1S2. Okay? Now, okay? So that represents that neurovascular bundle, the inferior gluteal artery, which is supplying the muscles over here, and of course the inferior gluteal nerve, which is actually innervating, okay, the gluteus maximus, okay. Now, the next nerve that really can be traced in this particular area is really a nerve which we refer to as the posterior cutaneous nerve of thigh.
Ask me to repeat.
Huh?
Ask me to repeat.
No, well, we're moving from medial to lateral. So we're talking about the pudendal neurovascular bundle. Then we're talking about the inferior gluteal artery and that neurovascular bundle associated with it. So the nerve, the artery, the veins, and then of course the lymphatics. Okay? Then the next nerve that we're going to encounter is what we call the posterior cutaneous nerve of thigh. Okay? And that perforating branch, posterior cutaneous nerve of thigh, is really a nerve that basically descends, okay, in the region, okay, in the region of the sciatic nerve, okay. Now, the perforating branch, there's also a perforating branch of the thigh, okay, and that perforating branch of the thigh has two important components. The first important component is basically that it really comes superficially in the tissues, and it really has a way of perforating, okay, beneath the lower limit of the gluteus maximus, or in the region of the gluteal fold. And that particular subcutaneous nerve actually wraps around the inferior border of the gluteus the gluteal area and actually ascend on the lower aspect of the gluteal region to supply innervation. The root values of that nerve is actually S2, S3. Okay? S2, S3. Okay? Now, after that particular nerve, then we have the sciatic nerve. Okay? Now, the sciatic nerve root values, okay, are usually L4, L5, S1, S2, S3. Okay? 4, 5, S1, S2, S3. And we know that the sciatic nerve really consists of two particular components. It has a tibial component, okay, and it has a fibular or peroneal component, okay. And of course, most of the times, the book will actually describe that the division into the tibial and peroneal component will actually make a division somewhat a little bit above the knee itself, the popliteal fossa area. However, sometimes you'll find that nerve itself can actually be seen to actually divide into its two components. Okay, in this particular case, we're talking about the two structures actually still united here. And when you really look at the sciatic nerve, you will notice that you have a prominent vessel, okay, that is really running with the sciatic nerve. And that is usually a branch, that is usually a neurovascular bundle that is running from the inferior gluteal artery itself. Okay? Now, the root values, right? If we are to break the sciatic nerve into its different components, the tibial component is usually L4, L5, S1, S2, S3. Whereas the peroneal or fibular root values are usually L4, L5, S1, S2. L4, L5, S1, S2. Okay? All right. Now, usually in this area also, right, coming out below the piriformis muscle is usually another set of nerve or neurovascular bundle, which is basically a small nerve which has a way of really sinking and staying deep. Okay? Stay deep. And of course, really, that particular nerve, our neurovascular bundle, is a neurovascular bundle which will be going to supply the obturator internus. In other words, the obturator internus. Okay? There is also another nerve which is really coming in this particular vicinity also, which is responsible for innervating a very important muscle that you can see the sciatic nerve really as it descends out the greater sciatic notch, inferior to the piriformis muscle. It is running over a square, okay, a square, right, a square muscle, which is basically a lateral rotator of the femur, okay, and which is known as the quadratus femoris. Okay, are you seeing that? This is the quadratus femoris here. All right. I have to do a delicate balance between the light and your visibility. So this is really the quadratus femoris. Okay? The quadratus femoris is actually arising. The ischial tubercle, the quadratus femoris, is actually arising in this particular area, okay, just outside here, and then of course it is running laterally, okay, right? Your quadratus femoris is actually running laterally, and of course it is basically looking to actually insert, right, all along this particular ridge. Okay, all along this particular ridge here. Okay, you can see this elevation here. All right, yes. Okay, this is really the area for the insertion of the quadratus femoris. Okay, now, what is the root values of the muscles? Well, before I go to quadratus femoris, okay? Now, the sciatic nerve, as it basically exits the greater sciatic foramen beneath the piriformis, it actually arches over the sacrospinous ligament, and what is associated with that particular sacrospinous ligament, okay? Inferior to the sacrospinous ligament is the lesser sciatic foramina, through which I said that the muscle that would be exiting this particular area would be the obturator internus. Okay? Now, associated with the obturator internus tendon is usually some small muscles that takes their purchase, okay? Take their purchase on either side, okay? Right? Of the sacrospinous ligament. And it's called they are called the superior and the inferior gemellus. Sorry. The superior and inferior gemellus. Okay? So, apart from the piriformis, you really have the sacrospinous ligament, you have the obturator internus, okay? It is usually seen somewhat superior to this area. And of course, associated with the tendon, you have a muscle above and a muscle below. The obturator, the superior gemellus, and the inferior gemellus, okay? So these are all the muscles that you're going to basically be finding in the gluteal area. Now, what are the nerve supplies, right? The nerve supply to the various muscles, okay? And it is usually easy if you can remember the rule that I'm about to tell you, okay? The nerve supply to the superior gemellus, okay, usually has the root values of the inferior gluteal, right? Inferior gluteal nerve, okay? So the nerve supply to the superior gemellus is usually the nerve supply of the inferior gluteal nerve, okay? In other words, the superior gemellus will have its nerve supply coming from L5, S1, S2. Okay? L5, S1, S2. Okay? Whereas the inferior gemellus, okay, will have the nerve supply coming from the root values, okay, which is equivalent to that of the superior gluteal nerve, which is L4, L5, S1. Okay? So just remember that shifting of the numbers. In other words, the superior gemellus will have root values of the inferior gluteal nerve, whereas the inferior gemellus will have root values of the superior gluteal nerve. Okay? Now, the root values of the obturator internus is also the root values of the superior gluteal nerve, which is basically L4, L5, S1. Okay? L4, L5, S1. Okay? The nerve supply to the quadratus femoris, if I'm not mistaken, is usually L5, S1. L5, S1. Okay? All right? Now, the lymphatic drainage of this particular area, remember that all these deep areas, their lymphatics are actually following the arteries, okay? The actual direction of the artery, and they are all going to really end up in the deep or the posterior group of lymph nodes associated with the posterior branch of the internal iliac artery. Okay? Now remember the superficially, however, the lymphatics that is draining the subcutaneous tissue, okay? And this particular area, they will all drain to the external group of inguinal lymph nodes. Remember the group of inguinal lymph nodes, they're usually just somewhat arranged like they, sorry, like they answer. Remember that the inguinal group has a medial group that has a tendency to basically drain the region of the mons pubis area, okay, and the anterior scrotum. Sorry. And then, of course, the lateral group has a tendency to drain the lateral aspect, okay, of the hip, including the gluteal area. There's an inferior chain that is usually located along the saphenous vein. And of course, those will all drain to the deep inguinal nodes, which are basically along the femoral artery, okay, as they basically go towards the external iliac artery. Now, what I forgot to tell you is basically that the perforating cutaneous nerve of thigh, which basically gave rise to those inferior branches that really curved around the inferior gluteal fold to supply the lower area, okay, of the gluteal area. That particular nerve also has a branch, okay? Once it really leaves the region of the inferior border of the piriformis, it actually sends a branch which basically curves towards the posterior medial aspect of the thigh, and it is actually responsible for not only supplying skin of the gluteal fold and the lower medial aspect of the natal cleft, okay? But it also will give some innervation, okay? If you can see here, this really is part of, this is female, yes. So the lower third, okay, of the scrotum, posterior scrotal area, or the labia majora area, this area will actually be supplied by that medial branch, okay, of that perforating nerve, okay? So you should appreciate that this particular area is coming from these short perforated branches. Likewise, in the natal cleft, okay, you usually have perforated branches that are coming from S2, S3, S4, okay? And they are actually supplying the upper medial area, okay, and the natal cleft region to as far as the tip of the coccyx, okay? Any questions so far? Any questions so far? Is it that we don't have an audience?
You said no.
Huh? What the answer? Huh? Okay, so you're understanding everything so far. Okay? So, again, you will note that as you really transition from the gluteal area you will recognize that this is the ischial tuberosity. porosity that we're looking on here. Okay? Okay? And this powerful muscle that we're seeing here is usually the biceps femoris that we're seeing here. Okay? So invariably once you transition into the thigh, the sciatic nerve starts running deep, getting deep into the region of the posterior thigh and is usually covered over by the important muscles itself. Okay? So this is usually biceps femoris here, okay, that we see here. And then of course remember that other muscles in this particular area will be what? Other muscles in this area will be what? Semi-membranosus, semi-tendinosus, gracilis. Okay, remember those? Say grace before T. All right. Say grace before T. No. There was something important I wanted to say a while ago. It literally slipped me. Okay. The blood supply in this particular area. We have spoken about the superior gluteal artery, and we have spoken about the inferior gluteal artery. Now there are really two anastomoses. Right? It's called the cruciate anastomosis. There are two sets of anastomosis that occur around the hip joint. And you remember that in the upper limb, there was an anastomosis around the shoulder joint, which proved very important, especially should you really have arterial damage involving the second part of the axillary artery. The same anastomosis exists around the hip joint itself. Okay? And there are really two anastomoses. Okay? One anastomosis actually occurs around the neck. Around the neck. Okay? Of the femur itself. Okay? And of course, really it involves arteries that are proximal. Okay? It also involves branches of the artery which is distal. Okay? So there are two anastomoses around here. One around the neck of the femur and one around the trochanteric anastomosis and the cruciate anastomosis. The cruciate anastomosis actually involves branches of the inferior gluteal artery, and it involves an ascending artery from the circumflex femoral artery, anterior and posterior circumflex femoral artery, sending an ascending branch, okay, on either side, okay? So there's an ascending branch of the circumflex femoral artery. You getting that? Circumflex femoral artery is usually in this region here, okay? In this area. It is sending an ascending branch from the anterior. This is the posterior aspect of the femur. So the posterior circumflex femoral will be sending an ascending branch. On the anterior side, anterior circumflex femoral will be sending an ascending branch. These two will basically form an anastomosis, a ring around here, getting a contribution from the inferior gluteal artery. Okay? Right? And occasionally, in the region of the small gluteal muscles, there is anastomosis between the inferior gluteal artery and the superior gluteal artery. Okay? Now we know that the superior and inferior gluteal arteries are branches from the posterior division of the internal iliac artery. Okay? So automatically you can see where these anastomosis is establishing an extension from the posterior division of the internal branch of the internal iliac artery and it is getting around this hip joint. Okay? Now, this anastomosis, by virtue of the ascending branch from the circumflex femoral, this circumflex femoral artery is really forming an anastomosis around the femur below the lesser trochanter. But it is also communicating, okay? In other words, once you get into the thigh, we're talking about the external iliac artery, giving rise to the femoral artery giving off the profunda, right? The profunda femoris, okay? The profunda femoris is the artery that is supplying the structures of the thigh, whereas the superficial femoral is almost like a highway artery. It is an artery that is actually carrying blood destined through the popliteal fossa. Okay, in other words, through the femoral canal, popliteal fossa to basically supply the leg. Okay, so circumflex femoral artery, anterior branch, posterior branch, communicated by their ascending branch with the cruciate anastomosis, but the first perforator of the profunda femoris, okay, which basically sends about 4 perforators, okay, as it really descends posteriorly here. It comes and it basically sends perforating arteries and really they wrap around, okay, laterally to come somewhat anteriorly. There are 4 branches, okay, and therefore the perforating artery, as it basically perforates around, it sends an anterior branch, sends an ascending branch from the first perforator, which comes up to the posterior, right? The circumflex femoral, posterior circumflex femoral. So by virtue of this perforating branch, right, from the first perforating branch, you are getting back to the profunda femoris and therefore back to the femoral canal, femoral artery. So you can see that if there is any injury involving the artery, the external iliac artery, okay, in the region of the groin, then blood by virtue of the internal iliac artery, the posterior division of the internal iliac artery, because there is an anterior and a posterior division. The anterior division are actually supplying the visceral structures. The posterior divisions are basically supplying more the musculature, okay? Giving rise to like the superior and inferior and the pudendal arteries that are destined to leave the greater sciatic foramen, some superior gluteal artery, and others inferior to the piriformis muscle, okay? And remember, at least 3 neurovascular bundles, the pudendal medially, then next is basically the inferior gluteal neurovascular bundle, okay? Then there are neurovascular bundles that are running to muscles, and those muscles are the obturator internus, okay, as well as the artery that are supplying the quadratus femoris, in that you're not going to see those arteries to the quadratus femoris from the back. In other words, they are running on the anterior surface of those muscles. Okay, so blood from the posterior division of the internal iliac artery by way of the inferior and to a lesser extent the superior gluteal arteries will communicate with the cruciate anastomosis, okay, around the neck. And of course, this anastomosis giving rise to the retinacular vessels that are running along the neck, okay, of the femur to supply the femoral head, okay? Don't forget that you have the femoral ligament with a small branch from the obturator, but usually it is very important in kids, but in adult life, that particular artery is of minimal significance. So these retinacular vessels. And then, of course, this cruciate anastomosis will anastomose with the anastomosis at the level of the trochanter, the trochanteric anastomosis, by way of the ascending branch from the circumflex femoris, right, anterior and posterior, that comes to this the cruciate anastomosis. This subtrochanteric anastomosis will have a branch coming from the first perforator, branch from the profunda femoris artery, and therefore blood can get by these two anastomoses to that first perforated vessel back to the profunda femoris, and therefore back to the femoral artery in the thigh, which basically is a branch of the external iliac artery. Okay? So you should appreciate that anastomosis. Now, I always draw your attention that when you're doing the upper limb and the lower limb, look for the similarities because they follow a similar pattern. Okay? And it's the same way in the upper limb, you really have an anastomosis around the shoulder joint in which arteries from the first part, okay? First part of the axillary artery and even the subclavian, third part of the subclavian, the dorsal scapular artery, suprascapular artery, all circumflex scapular artery, all these arteries are basically coming back, coming from the first part of the axillary artery, okay? And of course, they're by way of the scapula, okay, and the shoulder joint. They are coming back towards the anterior and superior circumflex humeral artery, okay? And of course, basically, those are branch of the third part of the axillary artery. So by this way, you can actually have a collateral circulation, which basically is coming to really keep blood supply going to the lower, the more distal limb. All right, so you should really appreciate that. So if I should just quickly recap the gluteal area, surface markings that you should remember, okay? The dimple that you see in the lower back, okay, just above the sacral area, okay, is usually corresponding to the posterior, superior iliac spine, okay? And of course, you know the iliac crest, okay? And of course, your anterior, superior, iliac spine, okay? This is the lateral spine, okay? Remember the muscles, okay? In this area, you're really going to find the gluteus maximus taking origin from this area, including the sacrotuberous ligament, and the iliotuberous ligament. Okay? So they're taking origin there. Remember, as they pass towards the femur, the lower half, the deep part of the lower half, okay, of the gluteus maximus is inserted into the gluteal tubercle. All right, the gluteal tubercle. All right, and the gluteal tubercle is basically in this particular region. This is really just a plastic bone, so it's actually not showing the region. All right, whereas the upper half and the superficial part of the lower half is basically inserted into the iliotibial tract. The muscle, the gluteus maximus is basically an extensor of the hip, okay? It can also be an extensor of the knee joint, okay? And of course, it is basically also a lateral rotator of the thigh, okay? Its main use comes into what we call actions involving the hip joint, like in running, okay, climbing a stairs, for instance, okay, but in quiet walking, usually it is not as significant, okay. So that gluteus maximus, once we really reflect it, we're really coming down to the small muscles of the gluteal area, and then of course we really find that the muscles are usually gluteus medius, gluteus minimus, and then of course more laterally is the tensor fascia lata, okay, which is actually the upper part of, inserted into the upper part of the iliotibial tract, okay. Blood supply, okay, the neurovascular bundles that are actually coming to supply this particular area. Where the muscles are concerned, the gluteus maximus is getting its nerve supply from the inferior gluteal nerve, okay, as part of the neurovascular bundle, okay, remember, neurovascular bundle, artery, vein, nerve, and lymphatics, okay, always remember those. So the root values of the nerve, inferior gluteal nerve, is L5, S1, S2, okay? And that nerve is that nerve supplies only one muscle, okay? Gluteus maximus. Okay? That nerve actually leaves below the piriformis muscle, okay? And actually curves directly along with its artery and its vein, okay? Now that is basically occurring more lateral than anything else, okay? We find that the small muscles of the gluteal region, medius, minimus, and tensor fascia lata, is actually supplied by a neurovascular bundle, which basically involves the superior gluteal artery, supplied by the superior gluteal nerve, a leash of veins, okay, because remember the veins are often multiple, and then of course lymphatics, which are deep. These lymphatics are running along the same direction as the artery. They are going to terminate in what we call deep iliac nodes, deep iliac lymph nodes, all right, that are associated with the internal posterior branch of the internal iliac artery, okay? So if you were to basically get an intramuscular injection and develop an abscess in this area, then of course the lymph nodes that would have that inflammatory reaction involved in the lymphatics and the lymph nodes, those lymph nodes are usually deep-seated, okay? Occasionally though, this particular area, lymphatics, will also communicate by way of overlying soft tissue, and of course inflammation involving the overlying soft tissue being the gluteal area. The lymphatics will drain around the side, okay, of the buttock to the lateral group of inguinal lymph nodes. The horizontal chain of inguinal lymph nodes along the inguinal ligament, the lateral group. We know that the medial group will basically drain areas of the mons pubis area, or the anterior scrotal wall, or the phallic area, okay, of the genital region. We know that the inferior chain of nodes are basically lying along the saphenous vein, which are basically coming from the distal extremity, okay? So back again, the root values of the superior gluteal nerve is L4, L5, S1, as opposed to L5, S1, S2 for the inferior gluteal nerve. Why is it important to remember the root values of each nerve? This is important by virtue of the rule to apply the nerve supply to the other muscles in this particular area, okay? Piriformis is actually getting its nerve supply directly from the lumbosacral plexus. I think the root nerve supply to piriformis is 2, 3, okay? S2, S3, okay? Now, when we talk about the inferior to the piriformis muscle, we're talking about a set of neurovascular bundles. Okay? Why I keep using the term neurovascular bundle? Because I want, every time you hear neurovascular bundle, 4 structures: nerve, artery, veins, lymphatics. Nerve, artery, veins, lymphatics. Okay? Alright? And in this particular area, where the artery is coming from, look to that very region for the direction of the lymphatics to drain to the lymph nodes. So all the arteries coming here are part of the posterior division, okay, of the internal iliac artery. 2 divisions. The anterior division that supplies the pelvic visceral structures. Pelvic visceral structures. Okay? You will remember that. In other words, from the superior vesical artery, inferior vesical artery or vaginal artery, okay, right? Prostatic artery, okay, middle rectal artery, okay, you remember all of those. All right, okay, coming off of that particular division is also the obturator, okay, the anterior division is also the obturator artery, okay, all right, don't forget that, all right. The posterior division is basically those two, the musculature. All right, and these are sending their arteries to supply the gluteal area as well as the perineal area, the perineum. Okay, and that perineum involves the entire area, not just the anal triangle area, but the urogenital triangle area, right, and the genitalia. Okay, so once we're talking about the structures, the most medial neurovascular bundle that basically leaves the inferior border, okay, below the piriformis, but out of the suprasciatic foraminum, okay, all right, is basically the pudendal neurovascular bundle. What are the root values of the pudendal? Remember the numbers of the obturator, the numbers of the femoral. L2, L3, L4 for the obturator, L2, L3, L4 for the femoral. In this particular case, the pudendal, S2, S3, S4. Okay? S2, S3, S4. Okay? After that neurovascular bundle, okay, then you basically find that there is usually the inferior gluteal neurovascular bundle, okay, and of course the root value of the inferior gluteal nerve 5 S1 S2, okay, all right, accompanied by its artery and the veins, okay, all right. Then what is also important, you will note from this that basically the vessels that are going up, okay, this is basically these would basically be coming directly into the gluteus maximus area. Okay, remember that you also really have an artery that is coming off the inferior gluteal that is basically giving a very prominent vessel that run alongside the sciatic nerve. Okay, so there is a sciatic nerve there. Remember that the sciatic nerve, when it basically exits the foramina, sometimes it actually will perforate the piriformis muscle, okay, lie within the piriformis muscle. And of course, that can serve as a source of great irritation to the sciatic nerve. All right? Now, where the nerves are involved, in terms of the nerve supply, we already said that this is 2-3, piriformis 2-3, but we know all of the small gluteal muscles. We have covered the gluteus maximus. So what are the other muscles? Okay, we know that coming out of the lesser sciatic foramen, okay, formed by the lesser sciatic notch, the sacrospinous ligament, and the sacrotuberous ligament, okay, those are the boundaries, okay. Exiting that particular notch is basically the obturator internus tendon. As it runs, comes round, wraps around there, and then turns laterally, to insert itself in that small little fossa on the medial see it? Okay? That fossa there. Okay? All right? What are the muscle inserts there? What are the muscle inserts there? This particular muscle. Okay? What is this muscle? This was the piriformis. All right? Okay? All right? Getting back to this, apart from that, okay, apart from this little fossa, we know that this greater trochanter is where our gluteus medius and gluteus minimus is really going to be inserted. Okay? Okay, as I said before, pudendal will actually wrap around the sacrospinous ligament, and it actually runs inferiorly and then anteriorly and medially, lateral to the ischiorectal fossa area, and it enters a new osteofascial compartment known as Alcock's canal. Okay? Right? We know that once it exits, it actually wraps around and it turns and it runs. Okay? To get into a canal that really runs all along here, and runs all the way back towards the pubic symphysis. Okay? And there's usually a little gap between the urogenital diaphragm, where the nerve actually passes through that space, okay, as it basically enters, okay, into the phallic structural area, both the male and female, and of course, really the blood vessels that are draining that particular structure is also passing through that gap between the inferior aspect of the pubic symphysis and the beginning of the urogenital diaphragm. Okay? All right? The urogenital diaphragm is extending all the way from my finger, all along here. Okay? All along to this particular area. Okay? So you can see that triangle. Can you appreciate this triangle? Okay? Your urogenital diaphragm is basically extending from there all the way to here. Okay? All the way to here. All right? This is not a very good representation of the pelvis because the tip of the coccyx should by right be here. And therefore, this is the urogenital triangle. This is the anal triangle. Okay? So the gap between the anterior part, this is actually where all those veins are actually draining, for instance, like the dorsal vein of the penis, okay? Veins of the penis and the deep veins of the penis coming into what we call the perivesical, periprostatic venous plexus, okay? In the female, those veins are actually draining into the perivesical, perivaginal, okay, venous plexus, perirectal venous plexus, and then they are actually communicating with the venous plexus that are actually communicating through the varus foramina of the sacrum in the vertebral, extradural space of the vertebral canal, and those veins are called Batson's plexus of veins. So the pelvic plexus of veins and Batson's plexus of veins. Lateral, coming out of those venous plexus, you will find that the veins
the complex of veins tends to coalesce to basically form a well-established vesical vein, okay, or a uterine vein, okay, that drains into the internal iliac vein, okay? Remember, the obturator internus associated with the obturator internus tendon are a set of small muscles called the superior gemellus and the inferior gemellus. Remember that the superior gemellus will have is supplied by a nerve which has the root values of the inferior gluteal nerve. Okay? In other words, the root value to the superior gemellus is L5, S1, S2. Whereas the root value to the inferior gemellus will have the root values in terms of its nerve supply, the root values of the superior gluteal nerve. Therefore, L4, L5, S1. Okay? All right? L4, L5, S1. Obturator internus, root values, L4, L5, S1. Okay? All right? And then, of course, this last big muscle here is the quadratus femoris. Takes its origin from the lateral aspect of the ischial tuberosity and actually inserts into the quadrate tubercle. Okay? All right? Which is basically a tubercle right along this particular area. Okay? Somewhat medial to the gluteal tubercle for the lower quarter fibers, deep fibers of the lower half of the gluteus maximus. Okay? This particular muscle, the quadratus femoris, is basically a lateral rotator of the femur, okay, the thigh. Okay? What you should appreciate about the superior, the small muscles of the gluteal area, they are usually abductors. Okay? They are usually abductors. Okay? All right. Okay, any questions? Any questions? Can we zoom in a bit, please? Gluteus maximus reflected, okay? So you can appreciate this. All right. So we reflect gluteus maximus, okay? And what we are actually seeing here, okay, is gluteus. This is gluteus medius, okay? Remember the posterior gluteal line, then between the posterior gluteal line, okay, and the middle gluteal line is the gluteus medius, and then between the inferior gluteal line, okay, and the acetabulum is basically the area of insertion, okay, of there's a gap there, but more anterior towards the anterior superior iliac spine is really the tensor fascia lata, which inserts in the upper aspect of the iliotibial tract. Okay? This muscle here is basically the piriformis. Okay? All right? And of course, we know that this and the obturator internus will insert into that little fossa on the medial aspect of the greater trochanter. Okay? Whereas these muscles up here, medius and minimus, are going to the upper aspect, the ridge of the greater trochanter. And these are actually what we call abductors, okay? Right? Of the hip. Right? Okay? This is basically the sciatic nerve. Remember, the sciatic nerve can occasionally pierce the piriformis muscle. Okay? We should remember that in a lot of cases, the sciatic basically consists of the tibial component and the peroneal or fibular component. The root values of the tibial component is 4, 5, S1, S2, S3. Whereas the peroneal or fibular component is again 4, 5, S1, S2. Okay? 4, 5, S1, S2. Okay? The nerve supply, again, to quadratus, okay? All right? You take its root value from the superior gluteal nerve. So this is 4, 5, S1, okay? Inferior gemellus, remember, inferior gemellus, 4, 5, S1. Superior gemellus, sorry, is the root value of the inferior gluteal nerve. In other words, 5, S1, S2. Okay? 5, S1, S2. Okay? Venous drainage, again, remember multiple veins. These are all going to drain back along with the artery. They are basically going to be going to the internal iliac veins. Lymphatics are actually going to the deep group of deep iliac lymph nodes, right? Internal iliac lymph nodes, okay? One important thing that I should tell you is that you recognize where the sciatic nerve is, okay? So let me leave this as an external marker and flick back the gluteus maximus. Okay? All right? Gluteus maximus. Let me put back the skin. All right? Okay? So, right here, this is usually the area where the nerve, sciatic nerve, is actually exiting. Okay? Now, when you're giving a deep intramuscular injection in the gluteal area, what we normally advise is really that you need to divide the gluteal areas into 4 quadrants. By drawing the line into 4 quadrants, that where those 2 lines meet, it's usually indicative of the area involving the sciatic nerve as it exits. This is really the last place you would basically want to give an intramuscular injection. Right where you see that little clear area. Okay? Because that is actually corresponding, okay? Corresponding to the area of the sciatic nerve. Okay? Alright? So you don't want to push a needle inside there and then give that injection. So we normally advise that you divide the area into 4 quadrants, and the injection must be given in the upper outer quadrant. Okay? The upper outer quadrant. Okay, so let me remove this. Okay? Right? 1 horizontal, 1 vertical line. Okay? So The injection should be given in the upper outer quadrant. Okay? Here. Okay? Alright? And not nowhere near this area. Nowhere here, because this is really where you're going to really find the big bulk of muscles. Okay? The fleshy mass of muscles. Gluteus maximus, and below that, medius and minimus. Okay? Alright? I might have missed a few things offhand, but what you do now, as I said before, try and remember the important pointers with regards to how you can work out the root values that supply the individual muscles by virtue of demarcating the root values for superior and inferior gluteal nerves. Okay? Alright? Once it involves the inferior gemellus, the quadratus femoris, okay, and the obturator internus, the root values for those muscles is really the root values of the superior gluteal nerve. As much as you see them lying inferiorly in the gluteal region, give them the superior gluteal nerve root values. Okay? The superior gemellus takes on the root value of the inferior gluteal nerve. Okay? Sorry. Okay? Where is that? What is the branch of the profunda femoris? Remember, the branch of the profunda femoris. I normally describe the arterial system is like a highway. The arterial system is like a highway. We are going, let's say you're going on, I want to use a practical example. Let's say, for instance, you're traveling from here to Ocherius, and you decide to take the north-south link. As you take the north-south link, there is usually an exit to Spanish Town, Angels. Then there's usually an exit to Linston. Then there's usually an exit to Monique. And then you basically come on to Ocherius. Each one of those exits is really carrying you into a community. Okay? A community. All right? So let's apply that to the arterial system. Here it is, the aorta is a big highway, major highway. And of course, we decide that, boy, we're basically going to we're going into the pelvis now, but we're basically going to the right side or the left side of the pelvis. So we basically go to the common iliacs. Okay? And when the common iliacs come now and it's coming through the pelvis, right? We don't live in the pelvis, but we are destined, we are going to the thigh. So we actually take the branch of the highway that goes to the external iliac artery, and we have smooth sailing. Okay? If we live in the pelvis, then we take the internal iliac branch. And that internal iliac branch will further divide depending on whether we live in the ventral section or whether we live in the dorsal section. Okay? Or the gluteal area. Okay? So if we live in the dorsal section, remember that dorsal part now can basically tell us whether or not we're going to the perineal area, which we live in. Okay? Or whether we're basically going into the gluteal area. Okay? Or whether we are in the superficial gluteal area, like the gluteus maximus region. And it will determine whether we take the inferior gluteal artery or the superior gluteal artery, okay, or the pudendal artery, okay? So we're talking about a local division, okay? So in the case of the anastomosis of the profunda femoris, remember where the external iliac artery now leaves the pelvis, it takes on a name change and it becomes the femoral artery. But the femoral artery is destined to give you nice, clear, uninterrupted passage on the way, all the way to the leg. But suppose you basically live, for instance, in the thigh. then you have to take the exit, and the exit is basically the profunda femoris artery. The profunda femoris have a way of basically going below the inferior aspect of the, what is that? What is that muscle? It basically, as it basically is moving off, it actually sends a perforating. In other words, the circumflex femoral, the posterior branch of the circumflex femoral, and the anterior branch of the circumflex femoral, and then it sends that descending branch that basically runs down deep and send the perforators that actually pass through. So the perforators actually pass and go to the posterior compartment. And that first perforator, it sends off 4 perforators, okay? Until it finally peters out and makes a contribution to the anastomosis, the cruciate anastomosis around the knee joint, okay? So even the knee joint, every joint have an anastomosis around it. So the very first perforating branch sends an ascending branch up, back to the subtrochanteric anastomosis, which basically is made up from your anterior circumflex femoral and your posterior circumflex femoral. Okay? And that anterior branch comes into it. But then remember that the anterior and the posterior circumflex femoral sends an ascending branch, okay, that comes up towards the cruciate anastomosis. And that cruciate anastomosis is basically getting a branch from the inferior gluteal artery, okay? All right? And as well as a branch from the superior gluteal artery, okay?
What structure belongs to the nerve root? 2, 3, 4.
Okay? Now, 2, 3, 4, remember I told you, the pudendal nerve, remember there are 3 when it comes to the lower extremity and the gluteal area and the perineum. Remember that you have 3 important nerves down here. Okay? We have the femoral nerve, okay, which basically supplies the anterior thigh. Okay? All right, muscles of the thigh, the extensors of the knee joint. Okay? All right? True? Flexors of the hip. All right? Okay? Then we have the obturator, which supplies the adductor compartment. So the obturator goes through the obturator canal, divides into 2 branches, and therefore supplies all of those muscles there. In other words, obturator brevis, obturator longus, adductor brevis, adductor longus, adductor magnus, including gracilis. Okay? And of course, it basically has a small muscle, which is basically above adductor brevis. Okay? Which basically gets it's blood supply and nerve supply, okay, from the obturator. Obturator and femoral is L234. But the S234 basically is the pudendal nerve. Okay? What is meant by say grace before T? Say grace before T. Sartorius, gracilis, okay? Semimembranosus and semitendinosus. Okay? So those are the order in which the aspansarinus, right? In other words, the tendons that you basically find inserted in the medial aspect, okay, of the knee and basically insert into the tibia. Okay? All right, remember the sartorius is the talar muscle. It is a flexor of the hip, a lateral rotator of the thigh, and a flexor of the knee. Okay? So they say grace before T is just to remember the order in which those tendons appear in the aspansarinus. Okay? The upper outer quadrant. Okay? Remember I said that what is important in this area is the sciatic nerve. You don't want to injure it at the time of giving an intramuscular injection. Okay? So you want to really stay and give it in this deep area. See all of this bulk of muscle that you find here, this is gluteus maximus. Then you really have all the smaller gluteal muscle, medius and minimus in that area. Okay? So you have to stay, run a line that when you divide the gluteal area, the horizontal line almost corresponds to the area where the sciatic nerve is exiting below the muscles itself. All right? And coming out. Once you basically make that line and stay above that line and to the outer half of the gluteal area, then you're in the safe area for a deep intramuscular injection in that area. Okay? This area. Okay?
Or would what? Insert into the pars anserinus. Yeah, the order. The say grace before T actually tells about the order from anterior going posteriorly. Okay? Sartorius gracilis. Repeat, sir. Sartorius, say grace before T. Semi-membranosus and then semi-tendinosus. Sartorius gracilis, semi-membranosus, semi-tendinosus. Right?
Membranosus, the B.
Membranosus. The B comes out in the membranosus and then the T, tendinosus. Say grace before T. Okay? Gracilis, not gracilis. Gracilis. I can't spell. Gracilis.
Yeah, anytime you have a difficulty with spelling a particular thing, go to Google. Type in whatever spelling you want to basically put in there, and Google will basically just almost like it wants to say, did you mean to write this? You understand me? And basically correct it. You'll find this thing. So you can actually use, if you have a computer, you can actually use a computer like a dictionary now. Okay?